So many patients find normal medical care just frustrating and unsatisfying. This way of doing things is distinctly different. Visits are considerably longer, much more relaxed. There are no co-pays, and so if things aren't addressed at a visit because we run out of time, then we can get together again. Because of the way we work, we can do that by telephone, we can do it by text message, by email, by video visits, or of course in person in the clinic. It's not really difficult to do family medicine in 10 or 15 minutes in a visit. It's impossible to do family medicine in 10 or 15 minutes in a visit. And the main reason for that is not necessarily the complexity of the medical care or the person. It's simply that patients need to know that they can trust the person that they're seeing. And in so many cases, you have to talk about minor things first to learn if this doctor or nurse practitioner or physician assistant that you're seeing is trustworthy. And by that time, the visit is over, and the things that are really on your heart that you need to deal with no longer can be addressed. And then it's pretty typical that you go back again another time and you're seeing another person that's part of the team, but you may not be seeing the same person you saw before. So the process starts all over again. That is not very productive, and it leads to patients that are dissatisfied. They don't want to go and see the doctor because it's multiple co-pays every time they go in. They have to pay something. And so by having a membership-based clinic, we make not only the visit more comfortable, but the whole experience more comfortable for the patient so that they can feel like they can actually get a relationship with somebody who can know them pretty well. We want it to be a better experience for everybody involved, not just the patient, but also the people that are providing the medical care, as well as the staff who work here. We want to get back the soul of medicine. That's what we talk about, restoring the soul of healthcare. And in many cases, I think that soul has been simply pushed out of the way by the way medical care is financed. And so by rearranging that financing model, we hope to be able to actually accomplish what doctors want, what patients want, and just make it a much more pleasant experience for everybody involved.
As Dr. Dave explained, the healthcare clinic experience is made possible by the membership model. Your healthcare clinic membership includes unlimited, unhurried primary and preventive care, 45 of the most commonly needed blood tests, many common generic prescription drugs, and education, peer support, and coaching through healthcare.health. These are all included in your monthly or annual membership with no copays and no deductibles. I think it's also important to mention what's not included. It's not emergency department care, not hospital or specialty care. Patented prescription drugs that are not available as generics are not included. Some of the more unusual and expensive diagnostic blood tests are not included, and we also don't have radiology. But for the things that aren't included in membership, we shop to get you the best price. So as you're deciding whether healthcare clinic membership is right for you, take a look at your current costs. Review your previous medical bills. What have been your physician or other provider charges? What have been your costs for blood tests and prescription copays? And if you have health insurance, what's your deductible? What's your out-of-pocket maximum? Many of the services that are available through your healthcare clinic membership are things that would otherwise be part of your deductible. In a previous video, I showed this image of the bill for blood tests my wife Lisa had, where 3 tests plus the blood draw cost $504 and was all out of pocket. And this was just for her and just for 3 blood tests. So it's quite possible that you could save enough on blood tests alone to pay for much of your membership in Healthcare Clinic. Healthcare Clinic member dues are simple and affordable. For a single person, it's $149 a month, for a couple, $249, and for a family, $349, no matter how large the family is. And if you pay for a year in advance, you get 12 months for the price of 10. But between now and April 2nd, we're offering you a special opportunity to get founding member rates that are 28 to 33% below the regular membership dues. And these same percentages will remain in effect as long as you remain a member of HELPcare Clinic. If you'd like to learn more about HELPcare Clinic, visit us on the web, send me an email, give us a call, or stop by to see us at 308 4th Avenue Northwest in Austin. We'd love to have you see the HELPcare Clinic difference for yourself.